Stress urinary incontinence, or leaking pee when you cough, sneeze, laugh, jump, whatever, is really common during pregnancy and after birth. But common doesn't mean it has to be your normal. Let's talk about why this happens. This is your pelvic floor. It's beautiful. It's the bottom of your bottom. It holds all the stuff in. It is very important, has very important functions, and everyone has one. Yes, even men. The reason why you don't see incontinence as much in men is because of the urethra length difference. So our urethra is about 3 to 4 centimeters, whereas in a man, urethra length is around 20 centimeters. Not only that, but we go through pregnancy and childbirth, which also impacts how the bladder works. Now, I would love to show you with the actual organs that came from with this model, but I have 3 small children and they have removed my organs. So if you look on the inside, your urethral opening is right here. That's where your bladder is going to go. Your uterus would be right here, and then your rectum right here. So your uterus kind of covers your bladder. Well, in most cases at least. Now, your uterus grows tremendously during pregnancy, so you may not notice as much incontinence at the beginning of pregnancy because your uterus is still fairly small. But at the end of pregnancy, you got this sitting atop your bladder. Now, if you think about all that pressure on your bladder, in tandem with the hormonal changes that happen during pregnancy and the changes that happen to your body, because your pelvis goes through a lot of changes as well. That includes the muscles in and around the pelvis, i.e. your pelvic floor. And this is why you may even experience stress incontinence if you had a C-section and didn't have a vaginal birth, because you still had that pressure on your bladder, on your pelvic floor during pregnancy. Now, I've heard it more times than I can count of people being told that there's nothing they can do. Pelvic floor exercises, pelvic floor therapy, strength exercises won't help with urinary incontinence during pregnancy because of these changes, which is absolute crap. Because even though you can't stop the changes, there's plenty that you can do during pregnancy to work with your body to reduce aches and pains, pelvic floor discomfort, and leaks. And pelvic exercises, pelvic floor therapy, strength exercises, they work. That is your prehab to set you up well for your postpartum rehab, so that when you have the baby, you're able to recover and rebuild strength and function in your body and not have to change your pants all the time. Check out my playlists for some examples of things that you can do, and follow me for more tips and information on reducing pain and pelvic floor discomfort to have a more comfortable pregnancy, prepare for birth, and recover well postpartum.